This is my presentation on depression in African Americans leading to non-compliance with health regimens. So the objective of this presentation is for you guys to understand the causes of depression, the risk factors of depression, where you can screen and how you can screen for depression, how to treat depression holistically. So some of the causes of depression are, substance abuse, definitely drugs and alcohol. These things are definite. Well, it's not a definite cause. It's not actually cause and effect. These things more so correlate with depression, or it could possibly lead to depression. Exposure to violence and trauma. These things can also possibly lead to depression. Unfortunately, single parent households, for the parent and the child, they have an increased risk of depression. Low income, poverty, these sort of things, and stress. A lot of the things that were mentioned before are all stressful. Low income is stressful. Exposure to violence is definitely stressful. Incarceration, all of those things are stressful and can lead to depression, possibly. So, in the United States of America, African Americans, they have an increased, they are more exposed to these risk factors than many other people, these things like poverty. So in fact, about an estimated 15 million African Americans are suffering with depression, and about half of those, that would be 7.5 million, are undiagnosed. This could be due to them being, exposed to many of the risk factors. So upon screening for depression, there's two tools that you can find on your MAR or your WOW, as they say, our workstations in the nursing workplace, where you can screen for depression. This is called the PHQ-2 and the PHQ-9. We typically tend to do these on admission. At least that's very common in my unit. If you don't know where to locate these, you can ask your nurse manager or your educator on the floor. And here's examples of them right here. This is a PHQ-2. You can ask them if they're just having pleasure in their things that they do, and just ask them if they feel depressed or homeless. A little bit more of an in-depth version is the PHQ-9. This is definitely has about 9 questions. I think that's why they call it the PHQ-9. So treating depression in African Americans, like I said earlier, half of that is undiagnosed depression. That could be due to mental illness stigma. That's very common in the communities. They don't want to be labeled as being insane and possibly risk being rendered unemployable or unsafe to do something. So you gotta overcome these barriers sometimes, and that can only be done through teaching and educate. You just can't stop depression. You got to turn off the stigma, and that's part of the reason why a lot of things get undiagnosed or untreated. So these are some of the holistic treatments, and the main reason why I pointed out this slide is because some people may not want to necessarily take pills for something like depression, especially in the instance when someone is depressed because they are appropriately grieving. This can be in the case of a recent loss of a loved one. Someone would be appropriately grieving and may be somewhat justified in not wanting to take medication for something like that. So these sort of things, they take away some of the guilt of treating a disease by using medication. And it's all around good. I'm sure these are good things to do even if you're not depressed. So exercise, diet, these are all holistic ways that people can treat depression, and they have been proven to be effective. So one thing that we can do is to examine our own personal bias about how we view the world. So what I'm saying by this is it may be very easy to think depression when you see a little old lady come into the hospital and you hear her background. She lives by herself and she's a widow and she's all hunched over from osteoporosis and things like that and just stays quiet all day long. You may think depression easily, versus you see a 20-year-old young male walk in who is an athlete on a football team somewhere and you never once depression ever crossed your mind. That's what I mean by examining your own personal bias. These things may happen all the time in the hospital. We may easily overlook it just because we get so used to how we are. So in conclusion, these are just some of the things that I want us to take in mind whenever we see patients come in that could possibly be depressed. Just be on the lookout for other ways that depression can be displayed. And here's a slide with a list of some of my references. I will be taking any questions if you guys want or have any.